Good morning, and now we get into another discussion, a topic that is rather sensitive to talk about, and according to my guest, is terribly stigmatized. Now, I agree with her, which is precisely why we're going to break the ice this morning. So I'm welcoming to the program a Fertility Specialist and Medical Director at the Trinidad and Tobago IVF and Fertility Center, Dr. Catherine Minto Bain. Good morning, Dr. Minto Bain.
Good morning, and thank you so much for having us here. As you say, it's difficult to talk about, but so important.
Well, thank you very much for joining me. I'll start the conversation by asking, for those who may not be aware, could you please define for us and explain precisely what infertility is?
So, infertility is when you want to have a child and it's not happening. And it takes a little while to get pregnant. So we usually say, it takes about a year or so to get that pregnancy. So infertility is when you've been trying, waiting for a year and nothing has happened. And it can happen if you've had a baby before, or it can be that this is your first try to get a child and you've not been pregnant before. So infertility is trying for a year and not getting pregnant. But if you're 35 or over, you haven't got as much time. So we bring the time frame down a little bit and say, well, people 35 and over, women should really be looking at 6 months trying.
Mm-hmm. Well, you just specified woman, but from your column, you said infertility does not discriminate. And I think something that many people aren't aware of is that men could be infertile as well. Could we expand on that?
Yeah, so it takes two to get a baby, unless you come to our unit and you're single and you choose donor sperm, but you still need an egg and a sperm. So you've got a man and a woman, and like anything in life, both can be involved if things aren't working out. And actually, infertility, when you're looking at the causes of it, is split fairly evenly between, around the world, we say about a third is just the woman that has an issue, a medical problem causing it. About a third, it's just the man that has an issue causing it, medical issue with the sperm. Or about a third, it's both. And interestingly, when we look at our data here in Trinidad and Tobago, we've been here 20 years. We did a big study looking over 5,000 couples. And actually, the top cause in Trinidad is male factor. And over half of the couples that come to our clinic have more than one thing going on causing their medical problem having a baby.
But what are some of the common causes of infertility here in TNT based off of that study?
Yeah, well, that's what makes my job so interesting. And actually, that's what makes, we have 20 women working in the infertility clinic, looking at all aspects of what can cause fertility problems. And we all love our job because it's so complex and it's never that straightforward. So what can cause it? Well, it could be something in the man's system. So you're thinking, okay, you need sperm to make a baby, so you need good numbers. Those sperm need to be able to get to the egg, and they need to be good numbers. So they get there, they need to be swimming. Mm-hmm. One thing people don't think about is those sperm need to be good quality. So when they get to the egg, they can actually make it into a baby. And the guy needs to be able to get the sperm there. There are problems with sex that can mean it's actually difficult to get sperm into the right place. So there's a range of things on the guy's side, and it's not just sperm numbers. It's not just a sperm test. And then on the woman's side, you need four things. You need eggs that are good, that are coming out of the ovaries so they can make a baby. So they need to be coming out, but they need to be good quality so they can make a baby. You need the tubes, and that's what gets the eggs and the sperm together inside the woman's body. Mm-hmm. You need a healthy womb for the woman, and then her body needs to be healthy so that there's not something stopping pregnancy, because nature will stop pregnancy if women aren't healthy. And then other things can as well. Other things seem to interfere. Medical issues can interfere and stop babies from growing. So a huge wide range of things.
But in terms of Trinidad and Tobago, again, focusing on that, and I'm glad that you share that information. We're blessed down here in a sense. We're very fortunate given our diversity. But in that sense as well, that diversity, do you find specific issues for perhaps specific ethnic backgrounds? For example, Indo-Trinidadian men, Indo-Trinidadian women, Afro-Trinidadian men, Afro-Trinidadian women. Are there specifics?
That's really important. And when I first came here from England 20 years ago, I was really struck by the high levels of sperm issues that I was seeing coming through the clinic. So we actually ran a study about 8 years ago looking at male factor sperm issues, because it's the number one thing showing up in our clinic. And the question was, is it related to your ethnicity? Is it related to where you're living? Is it related to your occupation? Is it something in the environment around you? Is it related to age? Is it related to smoking? And we found no difference between different ethnicities. We found no relation to where you were living. We found no relation to if you were living near to industry or certain things that might be polluting the environment didn't seem to be linked. All that showed up was that as men got older, their sperm got worse and it took longer to get a baby. And if you smoked, you were less likely to get a baby, and those are standard around the world. So do we think ethnicity, your genetic makeup, ethnicity probably isn't such a big thing for men, but a lot of male factor and problems probably do come through tiny little changes in your genes, but your ethnic background doesn't seem to be a big part to play for men, as far as we know. But there hasn't been a lot of research into that. Mm-hmm. For women, actually, yeah, so different ethnicities have specific problems. And Trinidad and Tobago, we see that showing up. PCOS actually falls much more, it's very widespread PCOS, but it's certainly higher in an East Indian population. Losing your eggs early, going through an early menopause, that clusters more in women of color, and it seems to cluster more in the Afro-Caribbean origin women around in Trinidad and Tobago. So there are interesting genetic and ethnic variations that we see, yes.
Well, that certainly is interesting, what you just mentioned there, that, even in terms of genetics and ethnic background in the instance of women. But let's speak about the other part of it, that every single doctor, regardless of your ailment, will always tell you diet and exercise is important. The impact of a healthy diet and regular exercise in terms of fertility, how crucial is that? In fact, how much of a factor could that even be in terms of treatment for infertility?
So that's the big question. The question is, how much does the way we live our lives and the food we put into our body affect our health? And the answer to that is it has to affect it. So what you're eating has a huge impact on your health, your cancer risk, your heart disease risk, and I'm sure it has an impact on fertility as well. So men should be eating a healthy diet packed full of fruits and vegetables. And nowadays we seem to think if you pop a pill into your mouth, you take a supplement, you'll make things better. So diet certainly has a big part to play. Maybe a little less so for women. Eggs in a woman are sleeping. You can't get to them very easily. Dietary supplements and food don't seem to get to eggs and change egg quality. But for men, you're making sperm fresh every second, 1,000 sperm with every heartbeat. And what you're putting into your body, food, and then bad things like alcohol and smoking, and the bad foods with all of the nasty trans fats. Commercially made foods, fast foods, they're putting things into your body that we're really not supposed to be having there in large amounts frequently. So yes, diet, smoking, alcohol, not sleeping well, not exercising. These are the things that the human body doesn't want. They make us less healthy. And infertility is a medical condition. So anything you're doing to make your body less healthy and not perform as well will impact on your fertility. Mm-hmm. But then there's a lot more than that. There's a lot of things that people can't control, and it's not lifestyle. And it's causing fertility issues as well. So there's a lot you can do to try and boost your fertility, things you can do to help yourself. But when it's not working out, you also need to come in quickly and not leave it for years and years, because there's often things that actually you're not going to be able to change, and you're going to need medical help with, a fertility clinic's help with.
Mm-hmm. Well, Dr. Minto Bain, we're speaking about the physiological aspect. Let's speak about the psychological aspect. I mean, as mentioned in your article, it's terribly stigmatized, this topic. In fact, Even some might be saying, why are you speaking about this so early in the morning? This is not the first thing I want to hear. But it is a conversation that is necessary, and it's certainly a stigma that we must break. Why do you think that there is this stance against speaking about it? Is it something to do with a masculinity complex, or is it something to even do with respect to women not wanting to discuss this or have other people know about it? Is it just embarrassing for some people?
It's embarrassing. People feel shame. It's something that it's very hard to bring up and talk about. It's not something that you want to have. It's to do with the sex that you're having with your partner to try and create a child, which creates a stigma in itself. There is an element of guys feeling, ashamed of having a low sperm count, women ashamed and fearful of losing a partner, fearful of what people are going to say. And if you listen to people who've been through it, they really deal with a lot of unfair comments. Often people don't even realize that someone is going through infertility. So it's highly stigmatized, and people dealing with infertility, and that's 1 in every 6 couples have either had infertility or are dealing with it right now. It's incredibly common.
Wow.
Yeah, and actually just in April, the WHO produced a new report, because we've been saying for some years, we suspect it's 1 in 6 couples in Trinidad. We've been doing some research, and it's hard to get good population data, but we suspect it's 1 in 6 couples here in the Caribbean. And actually WHO has just come out and said worldwide, they think in most countries it is actually 1 in 6 couples. And the psychological impact is huge on couples. Having a diagnosis of infertility, or even just struggling with infertility, the psychological impact on both men and women is the same as having a cancer diagnosis given to you. Mm-hmm. Just think about that. That's the impact it has.
That is rather incredible. I mean, it's emotionally stressing for somebody who is suffering from infertility, but at the same time, due to the stigma, they try their best not to speak about it, and is there great hesitation as well because of that stigma and people seeking treatment?
People come more often to the clinic. We certainly see people coming earlier now, which is wonderful. But I would say 80% of people leave it far too late. As a woman gets older, she loses good eggs. It's hard to get people pregnant in their late 30s and their early 40s. If you leave it late, you're less likely to get a baby. And that's the huge sadness of infertility and TNT. It's stigmatized, we don't think about it, we don't talk about it, people aren't taught about it in school, we don't talk about it much in the media apart from when people are interested, which is wonderful. And that conversation needs to get out there so people know, come early, find out what your options are, and don't leave it too late. That's a huge message to get out there. And the more we talk about it, the more open we are and understand that loads of people are dealing with this and it's not your fault, it's a medical condition, hopefully the stigma will come down and the conversation will get easier for people.
Now, I understand that infertility can be treated, but given what we've discussed thus far, with that stigma, it being emotionally exhausting and the psychological impact it could have, what about people treating themselves? Because I'm certain that given the statistics, the data that you shared this morning, that we will see people probably trying home remedies here in TNT.
Yes, anywhere in the world, nobody wants to go to a doctor. I mean, that's true for me, it's true for you, I'm sure. You're going to want to try things yourself, and that's normal, and do the things that might help. Look at your diet and make it better. Eat at least go for 8 portions of fruit and veg a day. Get more exercise, that helps your body and that helps your fertility. When we're looking at dietary supplements, things you can just pop into your mouth, they don't help at all if you look at the big studies. I mean, facts are maybe damaging and they do cost money. And I think that's what we need to come to. Money. It's expensive to buy supplements, and a lot of them aren't necessarily going to work. So coming to a fertility clinic actually in the long term saves you money because you can get good advice quite quickly on what you're dealing with. The big problem we face worldwide is that some people are going to need more expensive fertility treatments like IVF. And that's difficult. It's difficult for people to afford worldwide, and in Trinidad and Tobago, we're no different. Most people here, we're self-funded here. Insurance doesn't cover it, and it's a struggle for some people. And I think that's another conversation. Can we make fertility treatment more open for everybody? How do we get more people who need the treatment into having it? Can we have the insurance companies help in some way? Will the government help in some way and start having some publicly funded fertility clinics? That would be amazing. And I think it's something we desperately need.
Well, I'm glad that you've raised that. That is a topic that I'm going to ask you to stick a pin on, because we can expand on that certainly in another edition of AM Prime. But as we conclude, due to time, could you just, if there's a piece of advice that you can share this morning with couples who are struggling to conceive, with those who may be struggling with infertility because of that difficulty, they're not entirely sure. As a doctor, as a human being, what advice would you share with them?
I'd like to give advice to two sets of people. So if you're struggling with infertility, there is hope. There are many ways to have a baby, but you need expert advice. So you should be in a fertility clinic. Going to general doctors means that often the man isn't looked at, or the woman isn't looked at, or things are missed. So you should go to the place which deals with fertility. Mm-hmm. There is hope. There are many ways to have a baby, so don't give up, and you're not alone. And if you're not dealing with infertility, think of those around you. 1 in 6 couples, come on, there's going to be people that you know very well who are dealing with it. Try and be more open. Think about what you're going to say. We have an excellent blog on our website about what not to say to people who are dealing with infertility and how to help more.
Well, Dr. Catherine Minto Bain, thank you very much for joining me this morning. I've hoped we've done our part, or at least a start, in trying to break that stigma. And certainly I welcome the opportunity to continue the conversation. As I said, there is a topic there that I want you to stick a pin on, and we can expand on that later on. Thank you very much, though. Keep well.
Thank you so much. Thank you.